Thank you, Ron. Nearly 300 students at the University of Memphis are enrolled in the School of Public Health.
That's right. And these students are being trained to shape the health of our communities. And joining us today is the Dean of the school, Dr. Ashish Joshi. And welcome, sir.
Thank you so much, Kim and Joe, for having me here.
We're thrilled to have you.
Definitely.
So over the last 2 years, the School of Public Health has shown nearly 20% increase in enrollment. It's remarkable. This is located right there on the Park Getwell campus, right there at the corner there. What is driving more students to get a degree in public health?
I think, first of all, thank you for having me here. Very important thing is that we set the tone that we are here to serve people. I think the service is a very important element. So I think what is driving the students into public health is their calling and for service. Second thing is, how do we really translate research into practice, which means how do we create solutions to the problems, not just identify the problems. So I think the third is, students are post-COVID are starting to understand the importance of data to drive decision making. So I think public health gives them that opportunity to not only just live their passion, but also to make a commitment towards improving the health and well-being of all.
And this is the first School of Public Health to establish public health clubs in high schools to advance good health and well-being among youth. What kinds of clubs are they, and what are the students learning actually?
First of all, I cannot be so delighted to share, and I'm very passionate about this because I think we are not just the first school in the country, but globally.
Wow.
That is actually
That's
established
amazing.
the public health club. So I think the basic thing, how to keep yourself healthy. Why sleep is so important. What do we need to eat? So I think students may not always be very familiar with this. And I think once we train the students, they can take care of their own health and well-being, but then more importantly, they can also take the health and well-being of their families and ultimately the communities. And this education needs to start early, not late. And I think we are institutionalizing a problem-based learning approach.
Right.
We are really giving them real-world examples, case studies, rather than just to be in the classrooms. So our goal is to take public health beyond the boundaries of the academic walls into the community lens.
That's beautiful. Well, launched as our nation's first public health dual program, where high school students can take undergraduate public health work. Has that been received well?
Absolutely fantastic. I would say actually that this is something we are so proud here at Memphis to talk about, that we are the first school of public health in the nation that has been able to institutionalize high school students to get undergraduate public health courses. Sometimes students have courses related to health sciences, medical studies, nursing, but not in public health. And I would say that we have expanded our reach. As a matter of fact, we are trying to keep up with the number of schools that have tried to reach out. And this is not just its impact limited to the local scenario. We have actually outreach from the international countries that are actually reaching out to understand how this model has been institutionalized here in Memphis and for Memphis.
That's wonderful. The School of Public Health has significantly expanded its research portfolio from 2 million to about 27 million, excuse me, and the UofM is a Carnegie R1 institution in the top tier of research universities nationally. Undergrad and graduate students can be involved in research. Help us understand why this kind of research is so important.
I think, to be honest, the very important component is our partnership with the Shelby County Health Department. It's about our community partners. The best way to execute solutions is through resources. And research drives decision making of what works and what does not work. So I think this has not helped us in creating just the research impact, but it has also an economic impact. We at the School of Public Health have not been able to create about 34 jobs over the last 2 years. And I think so it's a social, economic, and a health impact. So research is a very critical component to driving this overall good health and well-being.
So in addition to your partnership at the School of Public Health with the Shelby County Health Department, led by Dr. Michelle Taylor there, you also have a connection and a partnership with Memphis Shelby County Schools and the Juvenile Court. How do these partnerships provide health services in the community?
I think public health is for all. Public health is not about just improving the health, it's what is causing poor health. So if we need to improve the health of the population at large, we need to understand what is causing it. Whether it is unemployment, whether it is school dropout, whether it is poverty, what. So I think our goal is to really approach public health from a very broad lens rather than just looking from the manifestation of a disease as an illness. So I think that's where our partnership with Juvenile Court, our partnership with District Court 6, Criminal Court, school systems, it's kind of an ecosystem. So I think we need to really reimagine public health, that let's not just wait for people to become sick, but how do we really approach to the problem before they become sick? And that's the whole focus.
Wonderful. And part of what you're doing in high schools.
And I think that's what we are hoping to set up a stage for this.
Right.
Absolutely. And this younger generation really wants to serve, don't they?
I will tell you, once you give them the tools, cannot imagine how they can think about it. I think they are creating solutions to the problems that they've been seeing themselves, rather than we just telling them what to do.
All right. Well, we're out of time, but thank you so much for joining us today.
Thank you for having me here. It's
Dean-
such a pleasure to be here.
Dean Ashish Joshi with the U of M School of Public Health.
It's a delight to have you. So we look forward to having you as you continue to build a better Memphis. That's what it's all about. And so next on A Better Memphis.